In the world of functional and nutritional medicine, the brain is a very hot topic and has been for about 10 years, and with good reason. It's a complex organ. It runs a whole bunch of things in the body. It's shiny, it's sexy, and new. However, in the process of focusing on the brain, are we missing something that might be not shiny, sexy, or new, and we're missing it? In fact, might our focus on something else that we're entirely missing something that we think we've been there, we've done that, and it's no big deal. But let's consider the scientific literature on symptoms related to the brain. Did you know that 53% of people with subclinical depression had fatty liver, and 45% of people with subclinical anxiety had fatty liver? And remember, this is subclinical. This is not enough maybe to send somebody to the doctor, but it's probably a part of their case and it's on their intake form. Besides that, non-alcoholic fatty liver disease patients have cognitive impairment and loss of self-esteem. Really? Wow. Non-alcoholic fatty liver significantly influences cognitive deficit and even creates a smaller brain tissue volume reduction. And people with fatty liver have 4 times higher risk of having cognitive impairment. Senior moments. They also have smaller brains, smaller total cerebral brain volume, pointing to a possible link between hepatic steatosis and brain aging, which is a really popular topic in the world of functional neurology. Those with non-alcoholic fatty liver disease have poor cognitive performance, specifically in 3 domains. 1 is general cognition. 2 is mental speed, attention, and psychomotor speed, which is how fast somebody can think. And then the 3rd is ideas, abstraction, figural creations, and mental flexibility. But that's not all. People with impaired liver health due to non-alcoholic fatty liver disease, get this, have so much systemic inflammation that it causes neuroinflammation, a really popular word in the world of neurology today, and eventually underpins neurodegeneration, another word that you hear in the functional and nutritional medicine space a lot. And if that weren't enough, fatty liver has been shown to accelerate microglial activation in the brain. So, by focusing on the shiny, sexy, and new, and forgetting about the thing that maybe we think is kind of old hat by this point, are we missing out something important? And you may think to yourself, fatty liver, I got it, no problem. I've been there, done that. It's easy. Not really. Because also when you look at the scientific literature, the vast majority of ways that we're currently using in order to identify people with fatty liver, miss fatty liver, they can be inaccurate, especially at the very critical early phases of fatty liver. So next time you have a patient or a client that has a whole bunch of brain-related symptoms, instead of looking at the brain, maybe we should look at the thing that might be causing those symptoms in the first place. I hope you guys found this helpful, and God bless.